Hello and a very good evening to all our viewers who are joining me live in this Facebook and YouTube interaction of News9. And today I will be speaking about how air pollution can intensify the COVID-19 situation in the country. Well, as you all know, the steep rise in COVID-19 cases has already literally brought the healthcare infrastructure of the country down to its knees. And India is employing all reasonable strategies to decrease and also curb the spread of COVID-19 in the nation. And one of the most important strategies that India is employing is reducing the air pollution levels. Now, reducing air pollution is very important for India than any other country globally, because so far we have seen the pandemic blaze through the spring and summer season, during which the air pollution is relatively mild. But now that we are transitioning into winter, it becomes all the more important for the COVID-19 policymakers to formulate an effective plan to combat high levels of air pollution during winter, which could reflect serious consequences. India also has the highest exposures to air pollution in the world and faces a double whammy with outdoor pollution as well as the indoor pollution. And COVID-19 is a respiratory infection, as you all know, and we know from other such infections that air pollution can worsen their severity through its impact on the immune response of a particular person. Well, in 2019, nearly 2 lakh respiratory infection deaths were reported in India, and they were linked to air pollution exposure. Simply put, air pollution may be an important factor that moves a mild COVID-19 infection to one that requires acute medical care. And in fact, even the SARS epidemic in 2003 indicated a link to the air pollution and also the increased mortality rate. Now, in order to answer a few questions surrounding this particular topic, we have with us Dr. Sitesh Roy. Many thanks for joining me in this live interaction, Dr. Sitesh. And my first question to you today is, does exposure to air pollution during a pandemic increase the risk of pneumonia?
Yes, Deepak, unfortunately, whatever data we have so far seems to suggest that having high levels of air pollution, which is measured in two forms, one as particulate matter and other as the noxious gases that are in the air. The particulate matter, what is called PM 2.5, which is the smallest particle, the PM 5 and 10, which are the bigger particles, and the noxious gases including nitrogen dioxide, nitrogen oxide, sulfur dioxide, methane, all of these gases being oxidative damage to the lining of the lung, as well as affecting what we call the ciliary clearance or the clearance mechanism of the lung, and also contributing to impairing the innate immune response in the respiratory tract and lungs. Can contribute to a COVID-19 infection becoming more moderate or severe from a mild case, and hence what might have been a simple cold cough fever might progress to a complete pneumonia. And interestingly, data that was published from Boston in the United States of America, where they looked at a cross-sectional study of almost 3,000 counties across America, found that even a 1 microgram per meter cube increase in PM 2.5 was associated with an 8% higher risk of mortality or fatality due to COVID-19 or even a severe outcome. So yes, the increase in pollution in India, having 10 of the most polluted cities in the whole world, according to the last WHO criteria, we certainly have concern as lockdowns open and as vehicular traffic and hence traffic-related pollution increases all around the country.
Right. Also, doctor, now many might not be aware about a particular cell that is called macrophage, which is present in the lungs, and they are used to digest and also destroy viruses. So how are these cells impacted by pollution? And also, when they're affected by pollution, do you think that these cells lose their ability to digest and destroy the virus?
So it has been very well known for a very long time now that when individuals live in highly polluted areas where the particulate matter, what is called PM 2.5 and PM 10 levels are higher than is considered a normal exposure, and a normal exposure is no more than a value of 10 or 20, and many a times India has cities with levels of 50, 100, 200, 400. We see that during Diwali and during winter season when there's a lot of crop burning that occurs, or there are wildfires that can occur in certain times. And these particulates, when they enter the lungs, the macrophages are the cells that eat these particles up in an attempt to protect the lung from the harmful effects of these particles. So if a macrophage is filled with a lot of these particles, it is not able to ingest the virus and neutralize it or kill it in an effective way, and then hence the innate immune defense of the lungs and the upper respiratory tract are impaired due to pollution. Also, there's also obviously, as I mentioned, oxidative damage that occurs due to the noxious gases.
Also, doctor, now there is emerging research which also suggests that air pollution, may alter lung cells in order to increase the number of SARS-CoV-2 virus receptors. So how true is this particular claim by a particular study?
So this has also been in vitro data where they have exposed lung cells to a variety of different pollutants. And what they found is that things like diesel exhaust fume, which we have plenty of diesel exhaust particles, and some of these noxious gases and particulate matter actually enhance the receptors on the cells, which are called the ACE2 receptors, through which the SARS-CoV-2 virus gains entry into the cells. So there is veracity and truth to this data that with higher pollution levels, the human being becomes most susceptible to the SARS-CoV-2 virus. So it is a concern in that sense also.
Now, doctor, for those who have chronic respiratory problems, do you think that pollution could probably lead to permanent structural changes in the lungs that erode a person's reserves?
Absolutely. So indoor and outdoor air pollution. So indoor air pollution from chulas, from burning wood inside a house that doesn't have good ventilation, from smoking inside the house, have all been known to increase the incidence of something called chronic obstructive pulmonary disease, COPD. And I do believe that outdoor air pollution contributes to the damage that ultimately leads to the progression of this disease. Even with asthma, though asthma is not caused by air pollution, it can be worsened by air pollution. Besides this, there is something called interstitial lung disease, in which there is fibrosis in the lungs. And very interestingly, people who have had SARS-CoV-2 infection, especially the moderate to severe kind with the pneumonia, are now coming back to pulmonary physicians, to us as allergy asthma specialists, with a picture in the lung that looks very much like interstitial lung disease and fibrosis. So I do believe that at a very deep level, the pollution causing chronic respiratory illnesses and also increasing the risk of pneumonia in general, even in children and in adults, and the risk of getting SARS-CoV-2 and getting it in a more severe form, and then being left with sequelae of SARS-CoV-2 COVID-19 infection, is all an interplay and an interaction that we have to be very cautious and careful going forwards, and having all the interventions that can be done at a local, governmental and policy level to reduce the pollution. Because truly, when we had a total lockdown, the air quality had improved immensely around the country. We can't get a total lockdown again, but we certainly have to take all the steps where the cars are doing their pollution checks. They are keeping their emissions to the least possible, and people using more of what I would call carpooling than individual transport to keep the pollution levels down. And then obviously we need more trees, because ultimately the trees are what keep us safe from pollution. So I really think that this requires a major effort on the part of individuals as well as governmental agencies to keep us safe.
Doctor, like you clearly mentioned that during the lockdown phase, the environment actually was, healing from the harmful fumes that were quite normal in India and also across the world. But now that, unlock phase has been enforced, which is the calibrated exit from lockdown, do you think that the situation can even worsen? And also the Bombay High Court also said that, the entire city is now turning into a concrete jungle where there are no trees at all. So how do you think this would impact India, and what does this all mean for India? And also, what is your message to the people, Doctor?
So I think that we have, just like we had not paid enough attention to the invisible microbial world around us, and hence COVID came to teach us a lesson. The lessons related to air pollution and concretization of our cities and towns, with the cutting down of trees in a very rampant and wide manner, is truly very harmful and bad for our quality of air, because trees, plants are like our external lungs. They take our carbon dioxide and give us oxygen. That's the very basic thing. They also trap a lot of pollutants and get rid of a lot of things from our environment that are not healthy for us. So I truly, truly believe that the biggest message here is, besides everyone using their face masks, doing their hand washing and sanitization, keeping physical distancing, people really need to look at what is their carbon footprint, how much of pollution are they contributing and producing in their lives through the use of air conditioners, through the use of cars, through the use of electricity, which is ultimately coming from coal burning, and make a difference in their own life first. And that can truly impact the entire society, city, country, and world at large. So the message is, wake up and know what you're doing in your life so that you can take care of yourself and your family for sure, and also take care of the future generations to come, and plant more trees. Just plant more trees, get our ecosystem back to its balance again. That's the message.
Right, Doctor, that was really well put across, in your last message. And that was Dr. Sitesh Roy, who gave us his insights and also spoke about how air pollution could increase and also worsen the risk of COVID-19. And his message was loud and clear. It's not just about wearing masks, following social distancing, and also maintaining a good hygiene, but it is also about, looking at the carbon footprint and taking all the necessary measures that are required for a healthier and also a greener future, because pollution levels can not only put the lives of us at risk, but also the lives of other species that coexist with us also at risk. So in order to avoid that, we will have to ensure that we monitor our carbon footprint and take all the precautions to lead a healthier and a greener life in the nearest future. With that, it's a wrap on this live interaction. Until next time, take care, stay safe, and also plant more trees. Thank you for watching.